Welcome to you all to this online conference on the development and preparation of the One Health AMR Partnership, a candidate for a future European partnership. My name is Jan-Ingvar Jönsson, and I'm the current chair of the Joint Programming Initiative on Antimicrobial Resistance, JPIAMR, an organization founded in 2011 that after 10 years of successful contributions, and you will learn more about this later on, today have 29 member states worldwide. Within Horizon Europe, the European Commission, in collaboration with member states, is planning the European One Health AMR co-funded partnership. And this future partnership will build on and further expand from the current JPAIMR joint research program. You will learn more during the conference about the objectives and the necessity of the partnership, which will strongly focus on the One Health approach, which is a logic development as our knowledge on the current and future challenges includes not only the human, but also the environment and the animal sectors and their interactions. The partnership will be able to continue the coordinating efforts of JPAIMR by planning joint activities and monitoring the progress to address the AMR health threats originating in the human-animal environment interface in Europe and beyond. The purpose of this conference is to bring together One Health AMR stakeholders, such as policymakers, civil society organizations, professionals, academics and research funders, private sector, to consolidate and fortify our mutual agreement or engagement and actions to tackle antimicrobial resistance. We will have an open discussion on the focus areas, participants, the global challenge that antimicrobial resistance constitute, and how this European partnership and initiative can have a leading role, not only in Europe, but worldwide, to initiate and support global collaboration on AMR, foster the next generation of scientists, and to align our efforts and work side by side, not only in research, but also in education, public engagement, and policy development. I'm very pleased that we have so many participants. It's a large interest, and I'm sure that besides the curiosity on the status of the partnership, there is also a large interest on how it will proceed, and this sets a take-home message already at this early stage of the conference. This partnership can only be accomplished by extensive collaboration and the willingness to support and to commit to the future participation. So with these initial words, we continue on, and we will have a talk that has been recorded by Peter Bayer, who is at the who's senior advisor at the WHO, and he will give an introduction video on why is AMR a global challenge.
Good morning, good afternoon. Thank you for inviting me to this conference on One Health AMR Partnerships. My name is Peter Bayer. I work for the World Health Organization in Geneva at the headquarters, and I'm the unit head for a unit that is working on research coordination and global impact initiatives. And you have asked me to talk about why is AMR a global challenge. I trust that everyone who is listening today has read or heard about the most recent publication on antimicrobial resistance disease burden that came out in the Lancet earlier this year. And so what is there more to say on why AMR is actually a global issue? The study shows very impressively that AMR is indeed a global problem, and I see from the program that Ramanan is going to give you a more detailed readout, so I'm not going to dig into that study. But I do want to highlight that while AMR is global, there are important regional differences, and the study shows it, but it's also very clear when you look at the most recent publication of ECDC and the WHO regional office in Copenhagen on AMR resistance surveillance in Europe, which is data from 2020 and to 2022. And it clearly shows that there are regional differences, even in a region such as Europe, and there's a clear north-south and east-west divide, and the more you go southeast, basically, the worse it gets. So while we're having a global problem, it is also very important to look at the specific problems, the specific challenges you have in certain regions. And then if you dig even deeper, you can see that also many differences between certain pathogens. So in the ECDC WHO study, you can see that while resistance for some drug pathogen combinations is rising, it is decreasing for others, and it remains fairly stable over years for another group. So it's really important to get good data, and so these studies are very important. It is also another point I wanted to highlight is that different populations and different vulnerable groups are impacted differently by AMR. And I just want to highlight the very high mortality of neonates from sepsis and from resistant sepsis, which is one of the biggest problems in AMR. And it is one where we at WHO are paying specific attention to. So efforts need to be made on many fronts, and without going into the details, I think I want to highlight that probably infection prevention and control and increasing the efforts to work on IPC is probably the most cost-efficient measure, and more attention needs to be paid to that. And coming back to the title of my presentation, why is AMR a global problem? I just want to highlight that this is something that has been luckily recognized by politicians globally today, because in 2022, we are seeing that the German presidency of the G7 has put AMR again high on the agenda. The health working group of the G7 is going to meet today, actually, and they are discussing inter alia AMR. I'm also very glad to see that the Indonesian presidency of the G20 is going to look into One Health surveillance as one of the issues they want to tackle. And as we have seen from the global disease burden study, we do need to have better data. The study really makes it very clear that there are many data gaps to fill. We are also having later this year in early March, a European Ministerial Summit in Paris, which is organized under the French presidency. So we are very grateful also that the French presidency is putting a huge emphasis on AMR, and that they want to identify gaps on a European level. Where should the priorities, how should the priorities be set for the next years in Europe in the fight against AMR? And then we have also truly on a global level, Oman, who is looking into organizing a ministerial summit on antimicrobial resistance in Oman later in 2022. So I think we can be optimistic that there is a global problem that is also going to get global attention. And maybe to cut it really short, I think we need more data, we need more research, but we also need more money. And we do hope that in these meetings, politicians will be able to agree on really comprehensive programs that are going to be sustainably financed to tackle the issue of AMR on a global level. In my team in WHO, we are going to publish this year a priority list of fungal pathogens of public health importance. This is an area which often is overlooked, but we do think that in particular from a One Health perspective, fungal infections are really an important issue because the fungal agents are used in plants, in animals, and in humans, so you have a truly One Health interface. And so this is actually a good theme to highlight also at today's meeting, which is a One Health conference. We're also going to revise the WHO list of bacterial priority pathogens, which is a list that we first published in 2017. It had a huge impact on research investments, So we are going to look into the new data, and we are going to revise the list. We are going to consider maybe new pathogens that we have not included last time. And this is a process that we are going to run in the course of the year. And we do hope that we will finalize this at the end of the year, early 2023. We are also revising the list of critically important antibiotics for use in humans, which is the WHO list that should govern which antibiotics should not be used in animals. And so this is an important tool, again, from a One Health perspective, and it's also an instrument we want to further develop to really be useful to our member states, to be used on the ground to decide which antibiotics should be used by veterinarians and which should not be used. And last but not least, we are going to publish a One Health research agenda, a project where we work closely with JPIAMR, and we are very grateful for the support and the collaboration we have with JPIAMR. I really would like to congratulate you also on your ever-expanding network of national agencies that are participating in JPIAMR. You have developed from a more European to a truly global initiative. And I think that is really needed. And with that, I would like to close, and I wish you very good deliberations throughout the day.
So thanks to Peter. I mean, I can't really thank him since he's not present. This was recorded, but this was a very nice introduction for this conference. But because of time, we move on. So the next speaker will be Professor Ramanan Laximenarayan, who is currently working at the Center for Disease Dynamics, Economics and Policy, which I think is located in both DC and New Delhi. And Ramanan is also a member of our scientific advisory board at the JPAIMR. So over to you, Ramanan.
Thank you. Thank you so much for the invitation to speak. I'm going to keep my video off because anyway, I'm going to show slides, and also because I happen to be in a place with slightly weak internet, which I had not anticipated. So I was asked to speak on, rather a mouthful, a value of transnational collaboration on AMR research with a One Health approach. Now that really covers literally the whole world. But let me first start by saying two things. One is that I think JPIAMR has done a truly outstanding job. I don't say this lightly in the sense that the model that JPIAMR has used of having countries be able to collaborate, have a single evaluation platform, do all the hard work of defining the key questions and the area and scoping, but at the same time allow countries to be able to get their own resources for their own scientists for research is, I think, a model that will get replicated in many other areas. So first of all, congratulations to the JPIAMR team. What you have done is absolutely, fabulous, but also very quiet, without all of the drama that so many other sort of research collaboratives have of the drumbeat. And without that, I think JPIAMR has done an incredible job. So I'm really proud to be part of the Scientific Advisory Board. I'm rotating off now, but it's been a great association. The second is, of course, that I think JPIAMR had recognized early and now is increasingly getting into the idea that One Health is really the way to go. And this is not just because this is the theme of the moment because of COVID. It's really because everything that we do on AMR is very clear that it points to connectedness of human, animal, and environmental health. In fact, CDEP, my own center, is now transitioning to a new identity and name, which is the One Health Trust, which is a much broader mandate to work on One Health. So you see two logos at the bottom, but over time one will go away. CDEP is going to go away and will just be the One Health Trust based in Africa, India, and the United States. So as Peter mentioned, we've had some action recently on AMR in terms of understanding the burden. But we've always known, and I'm showing you some pictures which are actually from the Financial Times because they do a better job, showing our studies than we do in our own, in our own analyses sometimes. That for many countries, drug resistance is a real challenge, and it's getting worse year on year. And it's a problem that unless you live in Germany or Sweden, where things might be getting a little bit better, using this drug resistance index, which is a measure that we use to aggregate in one single measure the state of where drug resistance is in the country, things are generally getting worse. This is the paper from the Graham group at the University of Washington that Peter mentioned, which showed that, or which projected that in 2019, about 1.27 million deaths were attributed to antimicrobial resistance, that's over here, and about 4.5 million plus were associated with antimicrobial resistance. So attributed is obviously a tighter definition, but even with that tighter definition, you can see that it ranks pretty high in terms of global cause of death, more than HIV/AIDS, more than malaria, and only behind COVID-19 and tuberculosis in terms of an infectious disease cause of death. And as COVID-19 goes away, hopefully with vaccination, AMR will be squarely number 2, tuberculosis. And the world will be hard pressed to figure out what it's going to do about AMR, because it can, so far it's been swept under the carpet because the numbers were not clear, not there, although every patient has suffered from it, every family that's dealt with it, every doctor who has to deal with it knows about it. It just was not clear. Now, 1/4 of the deaths linked to drug-resistant diseases are because of antimicrobial resistance. That's a pretty significant proportion, whether you take E. coli or staph or Klebsiella or strep. All of these have significant proportions of deaths which are attributable in 2019. And NAMR is truly global. If you look around the world, although the mass of the burden is born in South Asia and sub-Saharan Africa, although for different reasons. In South Asia, it's more high infectious disease burden, along with overuse of antibiotics and high levels of resistance, which are causing the problem. In sub-Saharan Africa, it could be the opposite problem, which is a problem of access to drugs which are affordable and effective. So we may have resistance. It's probably at a lower level than in South Asia. And of course, we have high levels of infectious disease in sub-Saharan Africa. And West Africa seems to do worse than East Africa. But I can see the entire world is really affected. Now, tied to that is the fact that we're in the middle of some pretty important demographic trends that are not going to be easy to reverse. The world in general is consuming more meat. China and India alone are projected to consume more poultry between 2 and 7-fold between 2000 and 2030. It's both because of increase in per capita consumption, but also because of increases in population in these two countries. So the combination means that we now have to produce these industrial quantities of poultry on top of what is already produced, and that will inevitably depend on availability of antibiotics. Now, antibiotics have made this possible for per capita pork consumption in China to go up 6-fold, and also the number of pigs produced. In fact, China now produces far more pigs than the United States. And in fact, even the largest pork producer in the US is owned by a Chinese company. And China, specifically pigs in China, consume half the world's antibiotics. These are big problems, and I would call them almost existential problems on the level of climate change. And I think we need a JPIAMR which is vastly expanded into far more countries to be able to address these questions, because these are not questions that can be just addressed by 1 or 2 countries or just in Europe alone. This is going to require a really global enterprise. Now, if you look around the world, China alone consumes more antibiotics than the rest of the world combined, in animals, that is. Of course, in humans, more consumption in India than any other country. But obviously, between China and India, we've got a serious problem in that part of the world, and of course, a burden everywhere. The total global consumption of all antimicrobials was about 131,000 tons, and it's projected to go up to 200,000 tons. We also have significant consumption in aquaculture, and so it's not just the terrestrial animals, all of which really add up. Now, when it comes to One Health research, and I'm switching to One Health research a bit because I think JPIAMR is obviously focused a lot on things which are, in some sense, slightly more human focused, but steadily moving far more into a very ambitious One Health agenda, which, like I said, is going to be really a model for One Health research in many other areas, including for, say, viral pathogens. So I think what JPIAMR does and how it focuses, its attention is really going to be, a sort of a roadmap for many other such initiatives. But what we focus on is really something which is interesting, which is that I found that all of the questions I tend to get focused on here are questions that are not just esoteric, not just about, nothing wrong with basic science, but basic science without a clear application tends to lose the attention of policymakers. Now, there's a great review on environmental surveillance by Joachim Larsen, who I see is who's here today, and he'll probably speak about this as well. But I'll just borrow this one slide of his, which is an excellent slide, which really maps out the difference between transmission of pathogenic bacteria between humans, animals, and the environment, and also the uptake of new resistance factors. And what they point out in this paper is that transmission is common, uptake is relatively rare. Risks are quantifiable with transmission, more challenging if you just have a when you're dealing with transmission, whereas with emergence, it may be vast but hard to quantify. And of course, one is mitigatable and the other one is completely irreversible. So what we really need to think about is also this idea of hazard versus risk. Now, we all to think much more in the One Health frame of just looking for places where there are reservoirs of resistant pathogens, and that may come with some challenges. So hazard, is really lots of pigs possibly being fed antibiotics, but that hazard becomes a risk only when you have this other part of the picture. And I think for us to now carefully map out what our hazards are and what our risks are is going to be really important too. Now, the risks, of course, as has been done by excellent work from the EcoHealth Alliance, is concentrated in South and Southeast Asia. And this is obviously adjusted for papers that are coming out in these regions. So you can see the top map is unadjusted for the total number of papers. The bottom map is adjusted for it. And you can see that once you adjust, you have a lot of risk coming out of China, India, Vietnam, Thailand, and so forth. So we really need to also have a plan for drawing all of Southeast Asia into JPIAMR, because that is the place where One Health research really needs to happen. It's great to do the work in Europe or in Latin America or the US. And hopefully the US will also join JPIAMR, but this is not going to be sufficient. Now, the 4 stages that I want to leave you with respect to where this One Health research is progressing. First is we are tracking resistance and presumed drivers in different domains. This is a paper by a colleague of mine, Tom Van Boekel, a couple of years ago, which shows that resistance even in animals has increased nearly 3-fold in food animals between 2000 and 2018. So even if people in agriculture don't care about human beings, which I highly doubt because they tend to be human beings, but even if they care only about the health of their animals, you can see that resistance is a problem for animals and for the well-being of animals. So I think we need to rationalize how we're using antibiotics in animals. I already showed you this bit about the aquaculture and connectedness, but what you also see that the aquaculture is only a very small proportion of the aggregate antimicrobial consumption. Most of antimicrobial consumption happens to be in pigs and in humans. Maybe we have more in common with pigs than we realize, but certainly, consuming antibiotics in excess is something that we had probably not imagined. The second is that we need to also do a better job correlating resistance in different One Health domains. Again, going back to a paper by Lars and the group at University of Gothenburg, the mean resistance rates in E. coli from hospital sewage compared with those in urine and blood samples, these are highly correlated. And if we can find these kinds of correlations and find ways of doing One Health surveillance around the world, which is based on sewage sampling, which is also being done by Frank Arstrup and other groups, then we can expand vastly our ability to do One Health research. The third is we really need to build evidence on the drivers of resistance, which is we can't just stop at correlation. We have to go to causality as well. And there are some papers which are now looking at, gram-negative bloodstream infections, associations with higher temperature, but also looking now at causal effects, and the fact that antibiotic resistance does increase with minimum temperature. I think we need to be far more ambitious in understanding why resistance is going up. And it's not just about antibiotic consumption, it's antibiotic consumption in particular contexts that is causing resistance to go up. And I think we need to have a much better handle on this. And the last but not least is really that there's no point doing all of this unless we can also have One Health interventions. Peter talked about IPC, infection prevention and control. What does infection prevention control mean in a One Health sense? What does it mean in the context of raising livestock? What does it mean when you deal with, environmental contaminants and sewage? We really have no idea. And unless we can expand our interventions, evidence-based, cover these other domains, we'll be talking about the problem, but never be talking about feasible solutions. Here is a situation where you have NDM1 found to be 20 times greater in the Ganga in India during the pilgrimage season than at other times of the year. But the intervention is going to be a little more challenging to figure out, but this is something that we really need to do. So you can see that in Rishikesh, which is actually where I happen to be right now, it's on the banks of the river. The difference between when there is the Kumbh Mela, when there's a mass bathing event versus not, is quite significant. No such difference in Delhi because there is no mass bathing event in Delhi of the same kind. So we really need to figure out how to really address environmental transmission of resistance. And we really need to catch these things fast. NDM1, we know that we detected it in 2013, but it probably was found a long time before. So 2 E. coli producing strains from 2006 were identified and stored clinical facilities in New Delhi. So if we had found this in 2006, could we have done things differently? Could we have developed better drugs for them? Could we have developed better tests for them? And this is what we really need to think about. Similarly for MCR1, which was first identified, of course, in pigs in China, but we now see MCR1 in many countries around the world. It's truly a global issue. But we now go back and see that MCR1 and colistin resistance was probably there as early as the 1970s. And there we really need to get back and understand what kind of movement of animals, trade, movement of colonized humans could have played a role in that rapid dissemination, which goes from the proportions being small like this to being much higher than that. And we really need to think about likely emergence, because at the end of the day, if we think of ourselves as being part of the new push to understand pandemics, every novel resistance strain, from a functional perspective, from a perspective of a treating clinician, represents an entirely new pathogen. And we need to understand them as if we're understanding new pathogens. And something like a global network is the only way in which this can happen. So, we have our own sort of attempt to do this in India right now. We're setting up a One Health surveillance site with a catchment area that covers ag, forest, and urban land, covers a 60,000 human population near Bangalore in India. And we're now collecting longitudinal data on resistant pathogens on humans, animals, and the environment. And we're happy to collaborate on people who want to do this. But we'd love to see this sort of thing happening in other parts of the world as well. We can no longer study the humans in isolation, and we also need to have external validity to these kinds of findings. And just like there are demographic surveillance sites all around the world, my hope is that there would be One Health surveillance sites around the world from which we can have a better handle and understanding on how to prevent, predict, and then also respond to the emergence of antimicrobial resistance, and of course, find ways to mitigate transmission. So my closing thoughts here are, first of all, thank you very much to JPIAMR for the opportunity. It's a real pleasure. But I really look forward to the rest of this meeting as well, to see how we can really think non-incrementally with respect to collaborating across countries, and the platform that we have now with JPIAMR of doing work that's collaborative but non-overlapping is really one which we should really use to the fullest. And I think we'll see great results. So thank you very much.
Thank you, Ramadan, so much. And I mean, I have to say and express on behalf of all the members of the JPIAMR, thank you for your kind words to the JPIAMR and bringing up what we have accomplished and the way we have worked. And that's very nice to you. We did occasionally lose you, but the take-home message, I think, was really clear. There are still a lot of things to do. And thank you for giving all these excellent examples on the link, for instance, between poultry consumption and how it affects human, and the very nice examples of the aqua industry, the food industry, and so on. So very, very nice. There is a question in the chat, and maybe we could have that question. I don't know if you see it. I can read it for you. Are you with us, Ramadan?
I can.
Yeah.
Yeah, I can see it.
How can the challenge to reduce antimicrobial use in the livestock production? Mainly, it's a question of how can we actually reduce use of antibiotics in food industry, maintaining animal health, and still have productivity. And there are good examples of that in some countries, I know, but maybe you could answer it, Ramadan.
You know, I think you're absolutely right. There are very good examples in some countries, but you know, there's a difference between the animal domain and the human domain, which is that in the human domain, if we know how to do something, let's say IPC, then it certainly advantages to us to help other people also do do the same thing, because it helps everybody with the prevention of disease. The animal domain, because of commercial interests, works slightly differently. That, for instance, the information on how to raise animals without using antibiotics is well known in some parts of the world, but there has been a reluctance to share that information everywhere because this represents some kind of commercial knowledge and some kind of competitive advantage. We need to get past that and recognize that this is a matter of human health and animal health at the end of the day. I don't think it's a matter of figuring it out. We need to experiment, the methods that we already know. The US, Europe are raising huge amounts of animals without antibiotics using vaccines and biosecurity. We can do this in other places. And just the other two questions that are out there, I think the specific protocols for One Health surveillance, we're still developing these, and we're following this kind of rubric that I just presented. And anything that we come up with, we'll put on the public domain, we'll put on our website, and we're happy to share it. And we'd love if other people also share their information so that we can all learn together. That might be something for JPIAMR to do, to put up a sort of a sharing platform of this kind. And of course, data is always going to be an issue, but unless we all collaborate, data is going to be an even bigger issue. At least now we can use data from other places and we can learn some things even if we don't have the data in our own country. So I think we really need to work together on this.
So thank you, Ramadan, so much, and nice to have you on board for the whole conference, and thank you for your inspiring talk. So we are going to move on, and the next speaker you can see on the screen here now is Alessandra Martini, who is working at the European Commission, and she is, of course, one of the key players here today because she's representing the European Commission that has initiating this proposal on the new partnership. So we would like to listen in what's new from the European Commission and the way you look upon the partnership. Please, Alessandra.
Good afternoon, everybody, and thanks, Jan Ingvar, for the presentation and introduction. And bit challenging the talks of today around One Health, which is indeed a very important element. And now I will share, will close my video, but we'll share the slides to give you a bit of a overview of where we stand on and what are our plans with respect to the One Health AMR approach and the partnership and the links with the JPIAMR. And my challenge is actually to keep the attention and high after this beautiful presentation with lots of actually food for thoughts from Professor Ramanan. So thank you very much for your lecture indeed. Now I will share my screen. So as a start, because we are working within a European policy indeed, we had published already a few years ago a new action plan and a new policy document to address the problem of antimicrobial resistance indeed. And at that time in 2017 was already introduced the concept of One Health in the activities that we have been proposing to follow up in the years to come. So this is the umbrella document, but also the umbrella framework in which we are operating at the moment within the European environment and within also the collaboration in the global setting. So this approach that we are following is based on three main pillars of activities. The one is those two are highlighted in yellow are really for the research and innovation aspects to tackle antimicrobial resistance, where we already have been identified the problems of not only addressing human health, but also, of course, human health in relation also with animal health, environments, and in an intersectorial manner. And also the importance of having a global agenda on antimicrobial resistance and the need to strengthen. So not only to focus on European structuring effect in the fight towards antimicrobial resistance, but also having the connections at the global scale. And that was also highlighted in the speech before, the importance. After that, as you might know, we launched our new program, Horizon Europe. So the new program for research and innovation that has built on the previous activities and programs we had before, with supporting different types and different level of activities and research that span from the pillar on the more individual basic research and frontier, bottom up, let's say, to addressing the issues of European competitiveness and global competitiveness as well, and the ecosystem for market and putting products on the market. And we have, importantly, a pillar on global challenges, which is divided in different clusters, let's say thematic areas. And among that, we have the health cluster, where we have been, this is the sector where we have been working, let's say, significantly also in the past programs to support research on antimicrobial resistance. And we had activities to support indeed collaboration and to strengthen and support the implementation of the JPIAMR as well. Under this program, what we have been doing at the beginning and in preparation of it, actually, we've been discussing with our member states, because there were already several activities ongoing in different thematic areas, and we wanted to be streamline and better decide and co-design together what actually areas are important to have collaborations and partnerships. And these partnerships are of different nature, can be between public organizations, member states and governmental organizations, but as well as partnership with private sector. And within the cluster of health, we had different partnerships planned. The color coding here is only to define between the yellow and brown the timing of the preparation of these partnerships, and the nature as well, for with respect with the first two highlighted here, which are the partnership that are institutionalized. So there really are legal basis behind to support this partnership. And you will see that, I will go back into that, the One Health AMR has been actually proposed by the member states and welcomed by the European Commission as a future work and collaboration to prepare actually a much ambitious, let's say, agenda and implementation program. Now, I don't go in detail into that because we all been reading and has been referred through this latest publication from the Lancet on the impact and burden of AMR and the aspects of the global dimension. So without further ado, this is just anyway important to link you to one of the partnerships that we just launched, which is the Global Health Joint Undertaking, which is a follow-up of the DCTP, so the European and Developing Country Clinical Trial Partnership, which was designed in previous programs and has been given further attention and support to continue within the current program. What is important here to know is that it has been recognized indeed that the global dimension, it's extremely important, but also within the design of the scope and the main objectives of the DCTP3, what it has been considered and added as a new element, it was the aspect of the antimicrobial resistance indeed. So the objective is to reduce the burden of infectious diseases in sub-Saharan Africa through development and processing and facilitation of the development of new intervention and products, including how to address antimicrobial resistance, and improve the national, I would say regional as well, and global health security aspect. So at the moment, the partnership has been launched, and they have also designed, they have a strategic research and innovation agenda, which has been published. And now they are in the process of preparing the first work program, how it works, because the DCTP program is also working on implementing calls and research activities. And there will be now element addressing the antimicrobial resistance. So this is quite, I think, of a much relevance also considering the program and one of the breakout session that will occur later in the afternoon. But going back to our partnership and the One Health, I want to go back and talk more about the One Health antimicrobial resistant one, which is very relevant for this audience. And I've added here, because these are under cluster health, also a very important partnership, which is on the make, which is under another cluster, so another thematic area of Horizon Europe. It is the one on animal health and welfare, so the PO partnership, which is also addressing importantly aspects of animal health and welfare indeed. So for the One Health antimicrobial resistance, this is something that will be put in the future of our Horizon Europe let's say, work program and work plan for 23-24, most likely in 24. But here it's to give you an idea of what we are expecting, or what is expected, and what are the outputs of this partnership. Indeed, as we all have recognized the importance of the One Health and the challenges also because of the, let's say, silos and the structural system that is in place, is expected that there is, in fact, the breaking down these silos in accordance indeed with our policies, and create a new and stronger ecosystem. To do that, indeed, is important, and is what should be, in fact, addressed, is collaboration and coordination in strengthening this approach. And this is cross-sectorial because of the animal, environmental, and human health, but it's also about broadening up further, and not only considering, for instance, antibacterial, but also other pathogens and other technologies, for example, vaccines. I'm naming some examples just to say that the broadness of this One Health approach is extremely relevant if we want to really reach ambitiousness and collaborate together. The global dimension indeed is very important, as said before, not only for DCTP3, but also within the new partnership. We're talking new because the One Health Antimicrobial Resistant Partnership is indeed something that is planned, but that shall also consider the global dimension and implement and strengthen the, let's say, the connection and collaborations with international organizations, not only within Europe, but also beyond. And this is something also JPIAMR is doing extremely well, and in their memberships and in their partnerships. There has to be a research and innovation agenda, strategic agenda to be designed that is expected to be implemented, in fact, from the partnership, and synergies with other policies, because breaking the silos is also, and collaboration is also not only with in the content of this partnership on its own, but also with other activities and partnerships which are either already existing or on the make. And I named animal health and welfare as one of the examples. So also the action plan for air, water, and soil are extremely relevant to this partnership. Now, how to prepare for that? There are a lot of changes, there are a lot of challenges, there is a lot of work to be done. Therefore, we call for a coordination and support action. There will be a follow-up presentation, probably more in detail on that. But this is just to highlight that the activities from the CSA that we expect. So the CSA, the coordination and support action. So an action, a small, let's say, coordinating a group that shall deliver towards the preparation of the partnership, shall deliver what? A research and innovation agenda, shall integrate the different sectors and let's say key actors, which are researchers, but not only policymakers and funders, because there will be in the partnership collaboration among funders, and sectors which are have been working not always in collaboration. So there is this expected also that the action will do, and also communication activities between the different disciplines and sector. The international cooperation aspects are expected. What is important to say, this is not starting from scratch. In fact, this work actually has been going on already in part by different already existing partnerships. And of course, the building block, the fundamental basis for the new partnership is the joint program initiative on AMR. But we have also other initiatives like the One Health European Joint Partnership and ECARS as well. So there are other initiatives that will be basically the basis where it will be built up on for the preparation of the new partnership. And there are also international organizations present also today at the meeting, and fora like the G7 and the G20 already mentioned, because of the high importance that is giving and the revamping actually of attention to AMR. So all these also, of course, not to duplicate efforts. How the partnership should look like. So what the work has to be started already actually, and has to continue in the coming in the coming months, is for the preparation of a proposal. And the partnership should in fact include, and this is important, the work of the CSA to define is the context and the objectives. So what actually are the objectives, the vision of this One Health AMR partnership, and the necessity to have, and what is the composition of the partners, what is the engagement, and then plan activities, resources. We know very well JPIAMR has been like pioneering, but also quite leading in the field, these transnational calls on antimicrobial resistance, putting together different funding agencies from different countries in a common work plan and common calls. This is extremely working very well, but this is not only one of the, this is one of the activities. There might be many other activities for which the partnership can, let's say, can make a difference. And the governance and the resources to be invested is something all to be designed. So basically, my presentation here is to give, to be given you the vision that we have within the umbrella of our policy on the One Health AMR, what is expected from the partnership to be designed, and also, and importantly, the building up on existing already structures and partnership, re-engineering them to leverage resources among partners and among new partners and new players with the aims and the scope that was presented before. And so I thank you for the attention.
Thank you so much, Alessandra. And this is, of course, the starting point, listening to the European Commission and to you, Alessandra. So we will move on with two presentations. The first one is by Laura Marin, who is the head of secretariat of the JPAIMR, who will give some presentation of the achievements by the JPAIMR in the 10 years that we have existed. And then I will also present some words on introducing how we will work for establishing and this partnership. So over to you, Laura.
Yes, hello, and thank you, JPIAMR, for the introduction, and welcome everyone. I'm very excited to be able today to present you about actually what are we doing in JPIAMR. So let's get started about JPIAMR. So who we are. So it's really a global initiative which brings together 29 countries all around the world. It really started years back as a European initiative with European countries together with the European Commission to really push in a pioneer way AMR research and AMR coordination globally. And in the last years has really been including members from Japan to Canada to Chile to South Africa. So we're very happy to build up this international collaborative platform to really with the aim to tackle AMR and how what can we do together? What can we collaborate together to really lessen the burden of AMR, but also to make sure that we contribute to the development of effective antimicrobial treatments and to keep the ones that we have. So in this sense, the niche and the core of what JPIAMR is doing is really to align and coordinate the research funds on antimicrobial resistance at national level and international level, and to support AMR research globally and with One Health approach. And we do that with a different scope of instruments. And last but not least, to really help in this interface with the global policy initiatives and policy activities and how to translate those research results into a policy praxis. So it's a very interesting way of working. So as I mentioned, we've just been working for a while. So we are started to celebrate our 10-year anniversary of JPIAMR. So it started really in 2011. And it's quite a pioneer initiative at that time when AMR was not that high in the agenda as it is today. So I'm very happy that throughout this year, we've been seeing the impact of our activities and the impact of the political agenda with WHO running a global action plan, the Commission also having an EU action plan, and the development of national action plans on AMR, and together and as a company, research programs that will support AMR research. So we've been going through all this journey, and how this all started is really by developing a joint strategic research and innovation agenda. So the core of our activities is really to define research area and research priorities in which we are going to be working together at the international stage. And we have been doing that through multiple consultations, scientific, at the policy level, nationally, internationally, and of course with the endorsement of all our member countries. The core JPIAMR is this agenda who has a One Health scope, and it was innovative at that time to include environment, to include transmission as research areas to be prioritized. So our scope of activity goes through therapeutics, the diagnostics, the surveillance, the transmission, the environment, and the interventions area. And we deploy actions to support those common questions, those common priorities identified. So in the current portfolio of instruments that we have, so we do joint research investments with different type of instruments. We also support AMR data sharing with different type of platforms and data. We also do a lot of strategy workshops, scientific scoping, really bringing the community together, and we interact this policy interface. And we are designing upcoming new instruments and also in the framework of the new partnership. If we look at our investments and what have been able to mobilize, especially in the last 6 years, so I'm happy that we've been able to mobilize 125 million euros to support research globally. So we've been supporting over 1,400 researchers all over the world, really in 77 countries. So beyond the research community in our members. So we have been able to build consortia with other scientists can join in, bringing their own resources, or also through the collaboration with developing aid agencies who has been able to allow us to support lower income countries' research community to be part of our consortium, to collaborate with our research networks in our communities. and be able to support also and to create this collaboration, not only with European countries, but also to have a full scope of lower and middle income countries involved in our activities. And we started really with a very much focused human approach in our activities, but I'm glad that in the last year we've been increasing our One Health approach, and now 42% of all our projects that we support has a One Health aspect. Just to give you a bit of a detail of exactly what JPIAMR supports, which type of research we support. As you can see, we've been looking also at what do we have at national level? What are we funding at national level? What are the gaps? What should be working together? Try to avoid overlaps. So it's quite strategically the selection of what we have been funding. So it has been very much focused on therapeutics in the discovery area, in transmission. That is especially exciting because we were one of the first funders who really support transmission research and to include in there the One Health approach. And we have a very large portfolio worldwide on this with really exciting results. And still especially the inclusion of environmental aspects. So we have a very rich portfolio who goes from basic science to more applied and policy linked elements. I would also like to give you just a couple of examples, just a glimpse of outcomes of this research that we've been supporting. So since we have been supporting research for several years now, we can start seeing the results of those research that we've been supporting and how this is contributing to find solutions in the AMR field. For example, in the area of therapeutics, our projects have already identified, for example, 6 new preclinical candidates, filed 5 patents. So we can see the results and how this is feeding, for example, the pipeline of antimicrobial development. So we are glad to see that. And in the transmission area that, as I said, we have a large portfolio, we've been able to support transmission research in the human area, in the animal area, in the environmental area, but also specific projects that are focused in the One Health elements purely. So it's a very rich portfolio, which is having very interesting outcomes. And I invite you to really read the results and the analysis of all these projects portfolio that you can find on our website. And also on the surveillance portfolio, I just want to give you also a glimpse of what are the networks that we support doing. You know, they are developing more elements that can have a direct impact on the policy level, and they develop guidelines, databases, protocols, roadmaps that can be used to improve the national surveillance systems and the international surveillance systems. And especially we have a lot of networks that are really focusing in developing One Health surveillance methods, which is very useful in a field that we need to develop further. And so we keep on funding and supporting research. So every year we open our calls, normally in January. So at the moment we have an open call on drug resistance on the therapeutics area that we have mobilized 90 million euros and it's open. So I welcome everyone to look at it and to apply for it. And in the upcoming months, we are going to open another call on networks dedicated in the area of diagnostics and surveillance. And we normally are going to fund multiple networks, and we have an approximate budget of 50,000 euros per network. So there's different tools and different approach and different funding opportunities that we offer to the community. But it's not all about investments, JPIAMR. It's about supporting the community in different ways. So we develop a lot of workshops and hackathons and tools really where we can brainstorm new ideas, scope for new ideas, identify gaps, identify roadmaps of actions, and building and helping new communities to grow, I would like to finish talking about the policy interface and how we collaborate with others, because this is not just about the JPIAMR member countries working together. This is really working together and also working together with all the other international initiatives on antimicrobial resistance. So we have changes with our initiatives. We really have a close collaboration with the other international funders, but we also work closely with in collaborative way, like, for example, as Alessandra was saying, with the European Commission, who contributes a lot to JPIAMR, but also with the UN, and very especially with the World Health Organization. As Peter was talking before, we have different collaboration slides with them, like contributing to the development of One Health research agenda globally. So we really work together and reach out in the AMR international landscape to really bring forward solutions. So therefore, how we work is really through strategic research agenda that is agreed among the members, that is agreed, is evidence-based, but the community identify these critical areas, and from this we develop a lot of actions, which is the research program in which we fund research every year and different activities, networks, and workshops, etc. And so our plan goes until 2024, and now we are excited to work further, to scale up the scope and the ambition level, and to develop a new roadmap, a new research program in the framework of a future One Health AMR partnership. And now Jennifer is going to tell us all about it. So thank you very much to all to be here today.
Thank you, Laura, for this very nice presentation on JPIAMR and all the things we have done and what we are planning, and that we are up running until 2024, which is really brilliant since we are considering a partnership starting 2025. So on the next couple of slides, I will then try to take the opportunity to present the outline and plans for the preparation and development of the partnership. What we suggested to include, how consultation with different stakeholders will be embraced, the main topics suggested to be part of the partnership, and how it's going to fulfill the need for a One Health perspective. So I would like to say then that this really shows kind of the structure and organization on the involvement of the partners. And it's important to underline that this is really a co-funded partnership between member states and the European Commission via DG Research and Innovation. And as is true for most of the other partnerships that has been started or will be initiated during this and the coming years, it is really important to stress the fact that this is going to be a research program, member-driven, in partnership with the European Commission. Because of the success, and you have heard it from some of the speakers and by Laura now, that we have been very successful as a consortium, the JPIAMR. So we will of course have a very leading role in this development. And Sweden has expressed the interest as one member state to lead a partnership during the preparatory phase, but also once it will be implemented later on. There is really a strong political will in Sweden, but also a strong commitment from major funders such as the Swedish Research Council to take on this leading role. Then, of course, it's absolutely essential that this partnership engaged and is developed through all member states within the European Union, but also other countries. And as you have heard from the previous speakers, this is really a global issue, and we need to connect and interact and work together worldwide. JPIAMR will really have a leading role here. Sweden is one of the countries that will take a lead on this and have a major role in this. That this needs good planning, good strategy, time, interactions, consultation. So it is really a realistic starting dates to launch the partnerships in 2025. So while the starting point of the partnership is going to be the EU One Health Action Plan against antimicrobial resistance, there are, of course, a lot of different issues that need to be tackled together and addressed in the context of environmental factors. So One Health is really going to be the focus, of course, and you have heard it before. And the mission of this partnership is to really increase what we have achieved, to acknowledge the importance of human health and the interaction with other aspects. And this preparation can only be done by all the member states of JPIAMR, other stakeholders that work in this sector, regardless if it's working on human aspects or animal aspects or environmental factors. The goal, I don't need really to say, but is really to answer the need of innovation to support discovery and development of new antimicrobials, new methods and technologies for diagnostic, monitoring and surveillance of resistant microbes, and better measures to prevent the spread of resistant strains. There will be room for new ideas of funding schemes, focus areas of research, but building on the agreement of translational calls for research and other activities. We need to interact and consult and find mutual interest and commitment to invest, or rather to participate in real terms with that ongoing initiatives and partnerships. And the figure on the right is merely showing the main focus areas of the future partnerships, to aligning research and investment, to develop the solutions by creating and supporting establishing of the vast ecosystem of AMR research, innovation, and policy development, and then to boost research and provide knowledge, evidence, capacity building, and actually connect to open science. This slide summarizes the way we look upon the three main objectives and the challenges of this research program. The first one is the development of effective and equitable antimicrobials for clinical use. Second one, understanding the mechanisms of emergence and transmission of infectious disease and AMR, and how to prevent, control, and treat infections. And the third is implementation of efficient policies and integrated One Health approaches to reduce the burden of AMR. So this slide, and you heard it by the previous talkers, and the importance of having a One Health scope and approach to this partnership, and this is going to be the main focus and how it's all interconnected. I really don't need to say it, that the One Health is the fundament for designing and implementing this partnership. But it also connects a lot to the research programs, the policies, the legislation, and to interacting with multiple sectors to communicate and work together. Many of the same microbes infect animals and humans. They share the same ecosystem that we live in. And all the efforts need to be connected here with this One Health approach. Although the human health is really in the center, since most of the research funders that are involved in this, at least now, are more related to human and medicine aspects. I'm going to say something on this preparatory phase in the coming 3 years. So this basically around 3 steps. The first one is called intervention logic, which means formulating the objectives. What kind of activities should be included? What type of instruments, funding instruments, should we have to support research? Are there any new ideas about the instruments? What are the expectations on the impact of the partnership? And of course, needless to say, this can only be prepared, initiated, and accomplished by the strong commitment of member states and their respective funders. And many of you are at the conference here today. Secondly, we need to build a basis for the collaboration. So the building collaborations in the middle here with other European partnerships within the health cluster that Alessandra talked about, or others that may be of interest to merge with and find common grounds for collaboration. And some are listed here. So for instance, these 3 organizations within the United Nations, the WHO, the World Organization for Animal Health, and the FAO, which is the Food and Agriculture Organization. Then finally, research programs. That's really what we're going to focus a lot on for the final preparation. This is the proposal for research programs that need to be developed. The starting point is the current JPAIMR SIRA, the Strategic Research and Innovation Action Plan that Laura talked about, and planning for its how to broaden it, how to expand it by input from other stakeholders and experts. Define what are going to be the prioritizations and to reach these objectives. And finally, of course, not the least, to actually develop and agree on the partnership proposal. As you can imagine, this is going to be a large challenge, timely, and we need to allow time. And as you heard earlier from Alessandra from the European Commission, we have secured support for the coming 2 years by approval of the CSA called Design One Health AMR. And this slide really shows how we think about the timeline. So in 2022, now it's time for us to start all the consultation with scientific and different stakeholders. We plan for different type of actions such as workshops and so on for finalize down and prioritize the efforts, shaping the portfolio of the different funding instruments, and then in 2024 basically prepare for the final partnership and the roadmap how the partnership is going to implement what the purpose and the objectives are. Laura talked about the current JPAIMR SRA, which is built on 6 pillars. We plan for these 5 now, and 1 is lacking here, and that's the environment. But the way we feel environment is going to be integrated in all this. So the way this is going to be organized and structured and to take the process on is to have an editorial board with different members, have 5 thematic groups working with expert stakeholders within the areas of therapeutics, diagnostics, surveillance, transmission, and interventions. And it is really important to expand this towards, of course, the One Health, but also to expand towards social scientists, the humanities, as behavior and impact measurements and policy measures are crucial for the whole partnership. And of course, at the bottom, the basis for this to work is the funders and the member states. We need to drive and develop this together. Consultations, I'm not going to say too much about, just some words that it is important and it has not really been determined, but it will be a focus area during 2022. And we intend to build on our previous experience from the JPAIMR, for example, the scientific workshops, online conferences, inviting young scientists, etc., to be involved. We haven't gone to not only work, of course, on antibacterials, but to expand into different areas. And here you also see what kind of member states and organizations that will be in charge for those type of consultations. And you also, on the actions, you on the right side, you see the way we're going to interact and work and gather all the information and suggestions and proposals. The take-home message from this slide is really that we are going to be very inclusive. Needless to say, and you have heard it at the beginning, we need, of course, to work and align together with all other type of initiatives. For instance, what's going on via the United Nations and the World Health Organization and so on. This is something that is already ongoing together with the JPIAMR and these organizations. But also importantly, and Alessandra was touching upon that, we need to link to other ongoing partnerships and the ones that are under construction and may actually start earlier than this partnership within Horizon Europe. And this is really important, and to define how this partnership is relating to the others within the Horizon Europe. And there are certainly a lot of common grounds and overlapping possibilities. And this is, we need to have a very open mind and invite these different partnerships. And this is already interactions taking place. So the next steps, this is kind of my final slide, is showing what is going to happen in 2022. There is the first one is, of course, to develop the strategic research and innovation action plan, which connects a lot, of course, to other type of documents. For instance, the WHO Global Action Plan, the current JPIAMR, the EU One Health Action Plan, of course. Then defining the objectives of the partnership is crucial. And to direct and to reach a clear focus on what do we want to accomplish with this partnership. And this SMART is basically an acronym for that we need to be specific, we need to think about how it's going to be measurable, how shall we achieve it, we need to be realistic, and we need to think about the timely. We have already touched on this. And then later on, and this is essential, we really need a mutual agreement to what funding instruments that the partnership will hold within its portfolio. And I'm not going to say so much about 2023 and 2024, just finalizing that you will find more information on this on on the homepage of the JPIAMR, where we'll openly provide information on how the work is going on. And many of you that are participating here at this conference will certainly be invited to different type of workshops and the work further on sessions. Also, thanks for the JPIAMR Secretariat and our Spanish friends for setting up this inspiring program. And thanks to the speakers and to the European Commission to be present here today. And I'm just going to conclude basically to say that this partnership on One Health AMR have all the possibilities to be very, very successful. And there is certainly a place and necessity for the partnership in the development of new research and innovation, new ways of interacting and work together. But also, I would like to stress that we probably, after these 3 hours, realize that we need to break existing silos. We need to tackle AMR globally. International cooperation is necessary, sharing ideas, data, results, innovations, policy document, and the importance of public engagement that was brought up by several of the breakout groups here. And regardless of your interest, your position, your organization you are working at, we ask you to follow the development and to engage. And in your home country, convince at your ballpark different stakeholders to participate. Commitment from multiple member states within the EU, but also from global organizations and other countries will make this partnership even stronger. And we need to develop it together, but we also need to be realistic, have an open and inclusive mind for all the consultations. And we need to have a strong focus on what the partnership is going to include and embrace, defined through the new strategic research and innovation agenda with a very clear One Health approach. So with these closing words, thank you for your interest in the partnership and in this conference and its development and future. And please follow us at the JPIAMR homepage. So thank you all for participating.